Greetings to you wherever you may be, and welcome to this, the very first edition of the Healthy People Podcast, a production of the South Carolina Department of Public Health. My name is Ron Aiken. I'm a native South Carolinian from here in Columbia and the Media Relations Director at DPH. I'll be co-hosting this podcast along with my wonderful colleague, Carolyn Culbertson. Carolyn, would you like to introduce yourself? Tell us a little bit about where you're from and what you do here.
Sure. Hi, everyone. My name is Carolyn Culbertson. I'm also a South Carolina native from down in the Lowcountry, and I am DPH's Internal Communications Coordinator, and I am thrilled to be here.
Yeah, we're very excited to get this off the ground. Our goal with this podcast is to spotlight people, programs, and issues of importance to the people of South Carolina, to their health and their well-being. Our vision at DPH is healthy people living in healthy communities, and that gets right to the heart of what we want to talk about in this podcast, especially today. But before we get started with our first guest, who we're very excited about, we need to do a little bit of housekeeping. Carolyn, do you want to tell people how they can follow us socially and subscribe to this and to future podcasts?
Yes, so you can visit our website at dph.sc.gov. That's dph.sc.gov. And then you can find us on Facebook and LinkedIn by searching SC Department of Public Health. And our Instagram handle is SC_DPH.
Excellent. And thank you for that. We do a great job with our socials, and Carolyn is amazing at that, along with our entire communications team. Now, without further ado, our topic for today is one that means something to me personally. It's a family conversation, and it's one that has just grown in impact and importance in South Carolina, especially among young people, and that's the rise of vaping and nicotine addiction. With us today to talk about vaping's health impacts, the risks of nicotine addiction, the current state of the market, and what kind of data we have on vaping in South Carolina is Catherine Warner. She is the Senior Communications Consultant with DPH's Injury, Tobacco, and Substance Use Prevention Section. And Catherine, welcome.
Thanks for having me. I'm happy to be here.
Before we jump right in, we'll let people know a little bit about who you are. So give us sort of your background, where you're from, and how you got to DPH.
Sure. Well, I got my master's in social work and then started working on health policy and access to health care. And that brought me to the Department of Public Health, where I've been for the last 13 years, focusing my efforts on tobacco prevention and control, as well as injury prevention. And again, you say it's a family issue. I mean, I think public health is near and dear to me. I've had family members pass away from diabetes and heart disease and complications related to tobacco use. I've also been impacted by opioids. And I just think that, it's an important conversation to have, and it's important conversations to have with your family and with your friends. So.
And they can be tough conversations to have. And so maybe it's a good idea to sort of start with some real basics. And for people that may not know this may sound simplistic, but it's important to understand how to frame these topics. And so really, what is vaping just as a baseline? And then how prevalent is it in South Carolina?
Sure. Well, e-cigarettes and vapes are the most popular product that's being used by youth and have been since 2014. And the basic explanation is that e-cigarettes are products that heat a solution of nicotine, typically, and flavors. They contain propylene glycol, vegetable glycol, and chemical additives. They first entered the market in 2007 and have evolved over time. The older versions looked kind of like regular cigarettes, and then came the little pens, and the pod mods became very popular. But in 2015, when Juul kind of took the world by storm, it took the pod mod to the next level, and it gave it a more high-tech design, more high-tech nicotine delivery, and then that youth-appealing marketing that really hooked the next generation on nicotine. But now what we're seeing is the development of disposable e-cigarettes and vapes. And so these are the products that are the most popular with youth. They're designed for single use. They're pre-filled, because I think I should probably also make it clear that you can buy systems that are open and you buy the liquid yourself and you add it in. You're constantly refilling. And you can even refill the pods yourself if you want to go that route. But most people either buy disposables, it's just all in one, comes in a wide variety of flavors, or they're buying the pods and then inserting the pods and replacing the pods and recharging their devices. So, and it's a very technical landscape. Y'all might be surprised to know that now you can get devices that connect to your phone, like a smartwatch, and that play video games and that work as, you know, music players. I mean, there's a wide variety of technical improvements that they're making to these devices that make them customizable and interesting and appealing to youth and young adults.
Almost like you go to the gas station and the gas thing that plays videos or plays music or something. And I'm sure there's just any way you can make that experience engaging and hold their attention or keep them engaged with it is probably something that's high on their list.
Absolutely. I mean, and if you think about how across the state we're seeing children as young as 11 and 12 using these products, I mean, they're definitely attracted to video games. If they're going to get one that's, you know, they come in cartoon character branding, they're in candy flavors, and then it also plays a video game. I mean, what 12-year-old isn't going to think that's cool?
Yeah.
You know?
And that transitions well into our next question. There's kind of this idea out there that vaping is safer or not quite as detrimental as smoking. What would you say to that? Is this true?
We cautiously state that safer doesn't mean the same thing as safe. So the way that I look at it is we certainly don't want you smoking tobacco products. We know the harm that causes. We've seen more than 50 years of Surgeon General's reports that point to the harms of smoking and overall tobacco use. And the research is still emerging on e-cigarettes. So we still have a long way to go before we really have any long-term studies that can definitively state some of those risks that we're looking for. But what we do know and what science is showing us now is that the flavorings that are usually meant to be ingested, not inhaled, can have long-term effects and even short-term effects. Back in 2019, we had the cases of e-cigarette and vaping associated lung injury in young people where they were having lung damage. And chemicals like diacetyl and cinnamaldehyde are two chemicals that definitely impact the lungs when you inhale them and can decrease their ability to fight off infections. And then we also are seeing studies from organizations like the American Heart Association and the American College of Cardiology, as well as Johns Hopkins University, that are showing that people who are vaping are showing signs of heart disease and increasing their risks of heart attack. Because what we do know is that when you vape, the nicotine found in these products, and nearly all of them do contain nicotine, it spikes the blood pressure, it spikes your heart rate, and both of those things increase your risk of both heart disease and heart attack. We're also showing, if you're concerned about your oral health, that propylene glycol and the flavors that are used in the products erode tooth enamel. So there's a concern from an oral health perspective too. But so I would say just to be cautious and learn as much as you can if you are using these products. If you don't use these products, don't start. But to just think about it in, like I said, that context of we have more than 50 years of research about smoking, but we don't have that about vaping yet. But even early science is showing that there are some concerns. So, just learn more.
That's the difficulty of some of the conversations I sort of mentioned at home to have is you just don't have the studies, the body of research turn to say, here's what will happen to you almost assuredly if you continue to use this product to this degree, because it's just so fresh. And so you can sort of speculate and take the studies that come out here and there to try to extrapolate long-term risk, but we don't know all the long-term risk. And so are there other health effects besides just the ones that you've mentioned that we should be concerned with or aware of?
Exactly. I would say yes. I would say that vaping exposes you to inhaling heavy metals like nickel and chromium and lead, and concentrations of heavy metals in the bloodstream and in the body is definitely not a good thing. And then there's also mental health effects associated with vaping and with nicotine use in general. But studies have shown that young people who currently vape have reported increased feelings of anxiety and depression. Vaping impacts your mood. It messes with your neurotransmitters. It can prime the brain for future drug addiction to substances like cocaine or opioids. And so, yeah, I think that mental health is a conversation that we need to be having more and more, especially with our young people. And so, if you are concerned that your youth is struggling with mental health issues and they're vaping, that can be something to watch for, because that can make it much worse.
Right. And so, what kinds of things are you seeing that lead people to vaping, or why do people vape?
That's a great question. I think it varies, and I think it varies by age group too. Among adults who vape, I think a lot of them have switched to vaping to quit smoking, for which I applaud you. If there's anybody out there who quit smoking through vaping, just be happy that you quit smoking and celebrate that every day. Learn more about vaping and then see if maybe you want to break free from nicotine altogether. Then there are young people who have reported that they are vaping because it's less expensive initially at the outset. And then we have young people who are vaping, I think, out of curiosity. They're vaping to fit in. It's for social reasons. But I think, in my personal opinion, the number one reason that people keep vaping once they've started is because of nicotine addiction. It's very quickly established, especially in youth. It can take as little as, 5 milligrams of nicotine in a youth who's using that regularly, and that's actually just the equivalent of like one disposable vape device, a 5 milligram device. And that can be enough to establish addiction in a teenager. And nicotine addiction it's a very difficult addiction to overcome. I think studies have shown that nicotine can be as, if not more, addictive than cocaine and alcohol. And it's socially acceptable, and then when you're vaping, you're not smoking. So people think that's also more socially acceptable. I don't know how many restaurants I've been in recently where, people just start vaping after their meal. And I guess they're thinking, because this is not a cigarette and it's not smoke, that it's okay. But, being exposed to vaping aerosol is also not healthy for bystanders. Those fine particulate particles can cause asthma attacks and increase the risk of heart attack in people standing by too. But basically the short answer, Carolyn, is just that it's a very hard addiction to overcome. I think it can take, multiple times of trying to quit before you succeed. It can take anywhere from 8 to 10 times. And to just keep trying, be patient with yourself, because I think once you realize exactly how addictive nicotine is, maybe you can cut yourself some slack a little bit and, just keep trying.
I grew up as the child of parents who were both heavy smokers. It was just part of the culture for them. Growing up, it was everywhere in the workplace. It was in everything that you would do socially. And so I grew up with a very I didn't like it, right? I was around it. I couldn't stand it. I hated secondhand smoke. And so I was a passionate non-smoker. And it seemed as if with, legislation that we had to prevent smoking in buildings and workplaces and all those wonderful public health improvements, we are almost going and backsliding a little bit with vaping. I'm seeing it more and more now in places that I hadn't seen it before, such as you mentioned, in a restaurant, in a church, just at people's houses. I've asked my kids not to do it. That doesn't mean they always listen when they go to the restroom. Just tell it on myself. And so I notice it more. And there are negative impacts from secondhand smoking. But one of the things that I also have noticed is that you talk about the increased nicotine content in a vape versus what was in the cigarettes of today and even yesteryear. And it's more. And then I also see people use it in combination, even though we're talking about vaping today, but like with nicotine pouches and other things. So there's access for our youth to these stimulants that are at a degree and at a level that we did see growing up, that we sort of need to come to terms with as a society and a culture and just be able to address.
Absolutely. These products are available in the community, and that's where kids are accessing them. And when you compare our data from our Department of Public Health South Carolina Youth Tobacco Survey, the one we did in 2021 compared to this most recent one that we did in 2024, we see increases that kids are getting their vapes from vape shops. And from they're being exposed to the advertising at gas stations and convenience stores, places like supermarkets and just retail outlets, which we refer to collectively as point of sale. So they're being exposed to these ads at the point of sale in the community. They're getting it. They're just walking into shops and buying these products and into gas stations. But where they're really getting it, and we saw increases in this too, comparing the 2 years, is they're getting them more and more from friends and family. And this is that sharing behavior. They like to just go into the bathroom at school and, pass the vape around, or go to the football game and pass the vape around. And so, but the access is an issue. And I think that it's important to understand that yes, the devices are becoming more cheap. They're cheaper, they're bigger, they hold more nicotine content now. You can find devices that hold as much nicotine as 10 to 20 packs of cigarettes. It used to be that you'd buy an e-cigarette and it would have about 15 puffs in it, and that's like, I don't know. I think that was the equivalent to maybe a half a pack of cigarettes, maybe a pack of cigarettes or something. And now you're finding devices that have enough nicotine to sustain your habit and to, carry you forward. And it ends up being this astronomical amount of nicotine. And when you think about the impacts that's having on the brain, like you said, with like the prefrontal cortex and the way that the adolescent brain keeps developing until the age of 25. So up until the age of 25, you're still pretty plastic. And so nicotine's messing with those neurotransmitters. It's affecting your mood, your ability to concentrate, brain fog and attention, mood swings. And so I just think it's really important to understand that these devices are slick, they're popular, they're affordable, and the amount of nicotine that's available is just ridiculous. And it's the science too. So nicotine salts is a technology that's been pioneered by the tobacco industry, and it makes it easier to inhale the vape. It makes it not have such a harsh, what they call throat hit. So it's a lot easier, and you're drawing it in deeper, and you're just getting more and more. And so, you take all of these things and combine them, and it's easy to see how, we reached our apex, or rather our zenith of youth vaping, rather, not just youth tobacco use, but youth vaping back in 2019. And we've seen it decreasing since then for a variety of different reasons. 1.5% of kids are smoking cigarettes versus 9.1% that are vaping. So it's completely surpassed all of the other products. The only other one that we see gaining in momentum now are those oral nicotine pouches that you just mentioned. So those are increasingly popular. And other products that we see increasing that hadn't increased before are those heat not burn tobacco products. There's products called snus, which are like a smokeless product. It's sort of similar to an oral pouch. Then you've got the oral pouches, and then you've also got dissolvable products. They look like little breath strips, and you just, pop it in your mouth and it dissolves like a Listerine breath strip or something.
Do you mind if I ask, are there certain risk factors that make it more likely that someone would pick up the habit of vaping when they're...
Sure. I think that's a good question, because I do think that there's research that shows that, at least for smoking, for sure, people use tobacco products as a coping mechanism for stress. And so among adults, we definitely know that, when people are experiencing financial stress or just any kind of stressors in their life, you can list several of them, that can be a risk factor for them to use tobacco products or to continue using tobacco products. It makes it harder for them to quit. And with vaping, what studies are showing is that children who experience what's known as adverse childhood experiences, or ACEs. Children who have experienced 2 or more ACEs are more likely to engage in vaping, and a wide variety of other risky behaviors as well. But vaping, alcohol, those are definitely associated with adverse childhood experiences. And so those can be things like having an incarcerated family member, domestic violence at home, drug use at home, things that cause a lot of stress in the child's life, and therefore they're looking for some sort of outlet to channel that, I think.
I think all those things help with the conversations that you can have with your kids, and sort of behaviors and signs to maybe recognize, to be able to tell, is this something I should bring up? And is this something I should be looking to sort of talk about? And when we think about sort of resources to begin those conversations, what are some of the resources that are out there for parents or anybody who's concerned about somebody else's vaping?
There are some great resources out there. A local resource I really like was pioneered by our statewide partner, Smoke Free SC, and it's called Vape Talk. And they have 2 tracks of Vape Talk, which actually was endorsed by the American Academy of Pediatrics. The first one is for youth, and it's all about educating them about the risks of vaping and the harm that it's doing to their brains and their mental health. And then there's a track for parents, and they can learn, ways, like you were just saying, to have that conversation and just have an open, honest dialogue with their kids, because it isn't easy to think of how you're going to approach this. Nobody wants to feel like they're nagging. That's usually not effective. Those of us with parents know that nagging virtually gets you nowhere. But there's also the Live Vape Free program, is through the South Carolina Tobacco Quit Line, which is the one that the Department of Public Health administers statewide. And so Live Vape Free also has 2 tracks. There's one that's for youth and young adults. It goes from ages 13 all the way up to 26. It's divided into different tracks so that you're getting the age-appropriate content, of course, but 13 to 26. And then there's a parents, or what they really refer to as like an advocate or guardian track. And it does the same thing. It provides that education and that information so that you can really get comfortable having those conversations, and maybe helping you look for some signs. If your child is suddenly way more moody than they used to be, if you're smelling fruity smells in their bedroom and finding all these weird little empty plastic pods laying around, things like that. But there's a lot of great resources. And then there's another one out there, a resource that I like is it was from I think it was the Surgeon General, and it was called Know the Risks. And I believe that is available online too. And that has information for parents and teachers and coaches. Department of Public Health also does a lot of work with schools to make sure that we're getting the information to teachers, because that's another audience where we want to encourage people to feel comfortable talking to kids about it. So, the more school professionals that we can reach with that information, so that if they want to have those conversations with their students, they can help them quit by referring them to the cessation resources that are available through Live Vape Free or This Is Quitting. And so we try to make all of that information readily available on our website. You can go to the Department of Public Health website, dph.sc.gov. In the top right-hand corner, you'll see that search function, and you can type in, we have a couple of different pages. You can type in e-cigarettes or vaping and find our vaping webpage, which will have more information as well as resources for parents. You can also type in tobacco cessation, and lists out all of the different cessation resources that are available for youth and youth and adults, and just a lot of other really great information to help you learn more about what this is and what's happening and what you can do about it.
This is a topic and a societal issue that's not going anywhere anytime fast. I think we're still seeing a lot of evolving pieces to it, especially when you talk about the complexities of the ingredients that go into them, the interactions that we don't even understand fully, the long-term effects of between the different chemicals, between different, even just the emerging and developing brain as it's going on, and what these different chemical and interactions do to it or how they impact it is something to follow. And I know that yourself, your department. We'll continue to be on top of that and we'll continue to produce things. And we're just grateful that you were here on our very first pilot podcast to be our inaugural guest. Thank you so much for being with us today.
Oh, thank you so much for having me. I'm happy to be here.
Well, Carolyn, I appreciate your contributions today and helping out with this very important conversation. I kind of want to do a little bit of maybe a final thoughts. What are some of the things that sort of stuck out to you today about this conversation?
I just want to say that I appreciate the compassion with which you share the information that is necessary for people to consider quitting, or just the information they need to understand this, or to help someone they know who might be dealing with a vape habit. So thank you so much. And there are a lot of great resources out there. Thank you for being here to share those with us.
Absolutely.
And, one of the first things I remember when vaping, just started to come around and you start to see people do it. One of the first things that I noticed was like just the volume of smoke or vapor that was coming out seemed to me to be so much larger than what I can recall from just see from cigarettes. I'm like, that's a difference. If they're trying to equate what one puff or hit of a vape versus the cigarette, it's not the same because there's just a different volume. And I appreciated you sort of explaining that it's those nicotine salts that make that so different.
Well, and it's actually it's actually that you can customize that, Ron, and the amount of vapor that is exhaled depends mostly on whether it's more of a propylene glycol in your mix or more of a vegetable glycol in your mix. It's one or the other, and I think it's if you have more I want to say it's more if you have the vegetable glycol, it leads to the bigger clouds. But yeah, I mean, but you can customize it. That's what I just think is crazy. If you that's attractive to you, as you want to release a giant cloud of vapor, then you can adjust that on these devices and customize it so that you can make it that way.
Wow, I was not aware of that.
Yeah.
Mind blowing again. Thank you again. And thank you all for listening to the Healthy People Podcast, which is a production of the South Carolina Department of Public Health. Carolyn, where can people go if they want to hear more podcasts from us in the future?
Yeah, so wherever you found this one, definitely go back there. But you can also find them on our YouTube channel. Our handle for that is at SC Department of Public Health. That's at SC Department of Public Health.
Thanks again to our guest, Catherine Warner, Senior Communications Consultant with DPH's Injury, Tobacco, and Substance Use Prevention section, for joining us today. And thanks to you, South Carolina, for listening. For Carolyn Culbertson, I'm Ron Aiken saying be healthy, be well, and we'll see you next time.